however many. Today, we're very pleased to introduce Claudia Sarmiento, who is the Spanish-speaking outreach worker, no, not outreach worker, mental health worker at Madison Community Services. Now, I'll just pass it over to Martha, who is going to introduce Claudia with some more details.
Hello, good morning to everybody. And yes, after a lovely day we had yesterday, we have today this seminar as Sue was saying. And I'm going to introduce you Claudia. Claudia Sarmiento, she's a mental health crisis counselor, and she's a Colombian who has been living in Canada since 2004. So she came to Canada as a refugee. And having said that, she knows firsthand what it means to be an immigrant refugee and everything that entails. Claudia got a social service worker certificate, as well as risk of focus therapy certificate. And in addition to that, she got a bachelor in social work here in Canada. Her experience has built a beautiful career. Currently, she's working at Madison Community Services as a mental health case manager and a Spanish-speaking crisis counselor. She has an extensive experience working with immigrant communities and individuals through her different jobs. Her job is a tough one, but despite the difficulty of her job, she loves what she does. So that's why she's here today. She's going to tell us more about the mental health situation for refugees. Claudia, welcome to our seminars, and you have at this moment the microphone.
Thank you. Thank you, Marta, for inviting me. Thank you, everybody, for having me and being able to share with me the information that I have for you. We're going to be talking about mental health and refugees. First, I wanted to talk to you about what is health. Okay, so I'm going to tell you the health definition. The World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. So it's the ability that we have of being well. Now, in the Canadian context, the primary factors that shape the health of Canadians are not medical treatments or lifestyle choices, but rather the living conditions we experience or they experience. So we're talking here about the determinants of health, which are housing, income, employment, social support, food security. Okay. Now the mental health definition. It is the capacity of each and all of us to feel, think, and act in the ways that enhances our ability to enjoy and deal with the challenges we face. And when we talk about mental health, we also talk about resilience. Now go to the next slide. Mental health is a continuum. So mental health is not fixed. It is influenced by a range of factors, including our life experiences, workplace, or other environments, and the social and economic conditions that shape our lives, or the social determinants of health, which I mentioned before: housing, income, social support, food security, employment. In the case of newcomers, immigrants, and refugees especially, these factors are become more important. So we can have good mental health, we can be coping with a struggle, like anything that happened to us, we can develop the resilience to cope and overcome. When we don't have that resilience, then we struggle. We should reach out for help at this time. And if we can access services, we don't get the support that we need, we are not physically well to cope with mental health, then we get overwhelmed. Now, let's go to a little of statistics. So mental illness in Canada. 20% of Canadians will personally experience a mental illness in their lifetime. 8% of adults will experience major depression. 12% will experience anxiety disorders. 1% will experience bipolar disorder. Schizophrenia affects about 1% in Canadians, and the lifetime prevalence of PTSD is approximately 8%. So what I'm trying to do here, giving you all these statistics, is normalize what is mental illness, because there is a stigma around it. So this explains to us that many people experience it and many people can function with it. So now we're going to be talking about mental health and newcomers, more statistics. So according to Immigration, Refugee and Citizen Canada, immigrants will roughly encapsulate 30% of Canadian population by 2036, with an increase from 7.5 million to more than 12 million. So it is highly important to evaluate admission category when researching immigrants' health, since they get selected to different three categories: economic immigrants, family class, and refugees. Reason for this factoring is because each category have different criteria and pre-immigration experiences. And also they face the cultural shock different according to their capacity, right? Refugee and trauma. Most refugees have experienced one or more traumatic events. Majority of them recover without intervention after reaching safety. So we're talking about the majority of refugees. And I think, for example, when we receive refugees here, some come directly from their countries of origin. Others have been traveling country to country. If we go back to the definition of resilience, they become stronger with all the obstacles, but also some might become more vulnerable for the experience, right? Now, the pre-immigration trauma and refugees, more statistics. An estimate of 80% recover without intervention in the months and years after of the trauma. Approximately 35% of those who develop PTSD might continue having symptoms after 3 years, the trauma, and at risk of secondary problems. Most refugees who have been exposed to trauma are able to adapt reasonably well. Now, we are talking here about 5, 6, 7 years, 8 years. If the person develops more complex mental health needs, they will have to reach out for support. Vulnerable refugee groups, resisting people who already have mental illness or mental health issues. Sometimes they haven't been diagnosed in the country of origin. Sometimes they already come with diagnosis and medication. We have survivors of torture or severe trauma, women, older adults, and unaccompanied children, people with disabilities, people who have previous trauma, and single adults. Post-migratory factors for refugees to be able to overcome immigration, right? So income, language, social supports, health services, housing, employment, and education. And these are the determinants of health, right? So if you have any thoughts, questions, I just wanted to provide all this information. We can open the conversation. We offer case management services. We do have housing, but it's only for the clients. We have partnership with other agencies, but housing right now, there's a crisis in the city. Everybody's asking for housing, and the system is overwhelmed. Shelters have no capacity. City of Toronto has no capacity. other agencies like St. Clair Multi-Faith, other agencies that provide housing have no capacity now. What I work is specifically with newcomers who experience mental health issues. And one of the programs that I work, and the core program works with everybody. And most of the people that we get referrals from CAMH, from everywhere. And the first thing they say is, do you guys provide housing? We don't. We have when there is a vacancy with other agencies that we partner with, but we don't have housing. Nobody have housing right now. Independent housing. Right. It's supportive housing because they have to have a case manager working with them. Otherwise, they wouldn't be housed with us. But independent in the sense of they live by themselves in the house. It's congregate housing. They share let's say the kitchen, but it's just for individuals, not families. Part of the support, there is supportive housing where they have staff on site. Wow, well, we don't work with people younger than 16, but what I can tell you is for the experience, adolescents, it's a difficult time for them, no matter if they are immigrants or not. It's a difficult time because it's their onset of mental health usually occurs during adolescence. Support for them here, counseling, how to help them if they are alone. It's just to, shelters, there are shelters, but as I say, there is no capacity. Now, when we want to help adolescents, we want to do it. But the main thing is, do they engage? Because we want to help individuals, but they need to be engaging. And with adolescents, not all of them are willing to do it. So the first thing is if they engage. For refugees, what I have noticed, for example, where I'm coming from our organization, we provide bursaries. Sometimes newcomers are receiving ODSP or Ontario Works, and they are entitled to receive, like, for example, ODSP provide the startup. And they are entitled to receive that money once per year to start a business. Some people want to buy a bicycle because they want to do Uber, whatever. Through Ontario Works, they are entitled to receive some free trainings, but only if Ontario Works approve. But sometimes clients, individuals, newcomers, they want to do something else. So we provide a bursary. We have a board of directors. We submit applications. They study the application. The bursaries are usually for study purposes, like if they wanted to have a certificate. Some ladies wanted to have like certificates to do aesthetics, like everything that has to do with makeup, because they can work at home. Some people want to get their driver license because they want to do Uber. So another clients that we had, they wanted to do the exams for, like, when they wanted to have accreditation here, they have to do exams, so we can cover for those exams. So with the situation right now, financial support is key. Now, with financial support, there has to be a criteria. It's not just like giving away the resources, but having a criteria. So you establish the boundaries, right? Those are supports that you can, but also then the client has to be encouraged to learn the language. Because to start business, they need to have certifications, right? So they need to get the language first as well. And educating the the client or newcomers, educating or guiding, explaining like immigration has a process. Nothing is going to happen in 1 year or 2 years. We deal with that on a daily basis because we have people who are doctors, engineers, you know, they come, they're professionals and they arrive here. They have high expectations. They get frustrated because they don't have some of them don't have the language. The accreditations are not valid. They don't know that. Or if they know, they don't know the impact of that. When they come here, they cannot pay for rent, right? If they receive Ontario works, it's $500. You cannot pay rent with $500. They cannot upgrade because they don't have the language. So it's very frustrating for them. But I think it's it's important for us to talk to them, to guide them, to try to explain and support and let them know that it won't happen in 1 year, because people have expectations of, oh, I've been here 6 months and I don't have this and I don't have that. Nobody does it. Nobody does it. It takes 3, 4, 5 years to establish in a new country. So they need to learn that too. And it is hard. It's hard. For example, now with the Ukrainians come with a different status. It's not permanent resident, it's not refugee. Not everybody is able to serve them. Immigration changes policies like this, but they don't update service providers. So service providers, we are like, okay, can we serve them? Because at the end of the day, we have to report in order for us to receive funding. We can serve 200 people, but if they don't count, it's like we are not doing our job. But those people need the support. But for example, Ukrainians, it's a total different history and situation. And also, for example, Ukrainians are mostly, in my experience, my humble experience, mostly women with kids, because the men have to stay in Ukraine because of the war. And there is a stigma with mental health. They don't want to disclose if they have mental health issues because there is history of oppression related with mental health in Ukraine. I'm sorry if I'm going out of the topic. It's just like it's a lot of things that we need to keep in mind. That I wouldn't know, honestly. I wouldn't know. But I don't even watch news because I live with the real. I live with whatever in the impact of the government. We receive it from and firsthand. There are always cuts in mental in everything. In everything there are cuts, and that doesn't help. And the other thing is we continue receiving people, and the system is overwhelmed. We can't serve everybody. There is a very important element in our job, and Martha's job too, and it's advocacy. So the government make changes we don't know until we face the issue in front of us with the client. And that's when we start figuring out how can we support. Government changes, as I said, like we don't, like me, for example, I'm not looking at it, even immigration, I'm not looking at it. It's just when we receive it in front of us, okay, this is changing. We have to start doing research. Where do we send this person? Who can help them? Because we are dealing with everything else, right? But all the changes, believe me, they get to us because people ask for help, and that's our job.
Yeah, that is true, as you say, Claudia. So we can see in the news the big changes immigration does, but the small changes, they don't they don't put that in the news. So it's hard for us as a social workers to be updated every day. And the government changes are, crazy. They change, I say a comma here and they add something here. So it's quite hard. And at the end, the answer they provide us is go to the IRPA, so the Immigration and Refugee Protection Act. So there are many things. And for example, like I mentioned, the one that the government suggests not long ago, where it say that people that came under the work permit, they can bring their family, and their family they can wife, they can she or he could have the work permit, but they didn't give any details until later, and those details are very are not explanatory. So there are no ways how to figure out the answers. Even I have heard many people experiencing lawyers and consultants that they work in the field, they don't know how to deal with those kind of situations. So it happened exactly the same with the mental health area and other areas related to the program we serve to the people we serve to.
Yeah, yes, actually. And what I noticed is, for example, Marta, you guys serve a broad community. We don't. We don't serve anybody with open work permit, or people who come with international students, or other categories. We all only serve permanent residents, protected persons, refugee claimants, people who the IRCC wants to serve. You have more control over that. You can offer more because you are no you're not obligated to report to IRCC. We do.
And that's true. And that happened with most of the organizations that are funded by the government. So there is a limitation who they serve to. So we have the privilege in the Bloor United Church and in United Church in general to serve people in general. We are open to serve even people with no status, citizens, because also for citizens, there is a limitation, right? So if they are a citizen, Canadian citizen, also there are some organizations, agencies or programs they don't, yeah. So yes, so we have that privilege in here and we're blessed for that.
Thank you, Claudia, and we appreciate your time